We're going to talk about chlamydia, also known as the silent epidemic, focusing on Chlamydia trachomatis as the pathogen. Chlamydia is one of the most common STDs in the United States. This disease causes long-term disabilities, infertility, acute illnesses, premature death, and can also increase the spread of HIV. Chlamydia mainly targets the urinary and reproductive system.
This sexually transmitted disease is caused by a bacterium known as Chlamydia trachomatis. Chlamydia trachomatis is a gram-negative, obligate aerobic intracellular parasite and has cocci shape. Chlamydia trachomatis comes from the family Chlamydiaceae, genera Chlamydia, and species Trachomatis. Because the bacteria Chlamydia trachomatis has a cell wall, DNA, RNA, and ribosome, they are considered bacteria instead of a virus.
Chlamydia is a sexually transmitted disease, one of the most common STDs. Chlamydia is transmitted by oral, anal, or vaginal intercourse with someone who is infected with the pathogen, Chlamydia trachomatis. Anyone who is sexually active can be exposed to the pathogen if not taken the right precaution. Generally, young people such as teens or young adults are at a higher risk to be exposed to the disease. An estimated 1 in 20 people are affected by chlamydia. Chlamydia lack metabolic and biosynthetic pathways and depend on their host cell for transmission. This illustration shows the life cycle of the pathogen Chlamydia trachomatis. Chlamydia exists in two forms during its life cycle: an elementary body and a reticulate body. The elementary body is an infectious particle that attaches to and enters the epithelial cells to replicate in the urethra or cervix. During replication, the elementary body transforms to a bigger reticulate body and begins to multiply. The elementary body undergoes endocytosis. This process takes place in an isolated area known as the inclusion. After 24 hours of replication, non-infectious reticulate bodies are changed back to elementary bodies, which leads to the burst of the cell wall and undergoes exocytosis from the host cell infecting nearby healthy host.
Chlamydia trachomatis cells are capable of taking over most culture cells, which means cells that are acquired from multicellular eukaryotes like animal cells. Because there are different types of chlamydia strands, the receptor-ligand interaction with the host cell has not yet been identified due to many experiments still being done. The studies have shown that mitochondrial outer membrane permeability play a role in the chlamydia cell, attaching and infecting the host cell. Lipopolysaccharides have also shown that it plays an important part in the infectivity to the host cell. Other tests have proven that lipids help Chlamydia trachomatis with the entry to host cells.
The symptoms of chlamydia vary between men and women. Men's symptoms include pain and swelling in the testicles, burning and itching around the penis. Other symptoms include discharge from the penis and a burning sensation during urination. Women's symptoms include abnormal vaginal discharge, pain during intercourse, and a burning sensation when urinating. Chlamydia initially infects the cervix in the female reproductive system and spreads up the fallopian tubes and then to the uterus. The damage of the tissue in the uterus can lead to chronic pelvic pain, infertility, and fatal ectopic pregnancy. Once the infection enters the reproductive system of the female, the bacteria causes inflammation of the uterus and the wall of the urethra, which can lead to pelvic inflammatory disease. Men who are infected with chlamydia typically acquire urethritis, which causes the symptoms of abnormal discharge and painful urination. A smaller portion of men who are infected develop epididymitis, which causes swelling and tenderness in the testicles.
Once chlamydia enters the genital area, the bacteria then enters the mucosal lining. After chlamydia enters the mucosal lining, the innate immune system responds by initiating and sustaining the bacteria. The epithelial cells are responsible for initiating Chlamydia trachomatis. In the early stages of infection, the cell is favored through inhibition of the mitochondrial pathway of apoptosis. The pathway requires the release of mitochondrial cytochrome C and capsules. The death of the cell occurs without getting a response from neighboring cells.
Despite the harsh symptoms, chlamydia can be cured with antibiotics. People who are HIV positive can still be treated with the same antibiotics to cure chlamydia. If a person is infected, he or she should refrain from any sexual activity for at least 7 days after taking the single dose of antibiotics. Common antibiotics prescribed orally include azithromycin and doxycycline. When they have completed their treatment, they are advised to revisit after 3 months of taking the antibiotics. People who were infected with this disease and were treated are still at risk with being infected again if they have had any sexual contact with someone who has chlamydia.
Chlamydia is one of the most common or widespread STDs since the year 1994 in the United States. Chlamydial infections have a high prevalence rate in young women and most times show no symptoms. A total of 1,526,628 cases of chlamydia infections were reported to the CDC in the year 2015, with the most recent report. Chlamydial infections by region of the U.S. were highest in the South with 520.5 cases per 100,000 population, and the lowest in the Northeast of the U.S. with 429.5 cases per 100,000 population. Chlamydia by age is highest in adolescents and young adults between the ages of 15 and 24, with a rate of reported cases of 1,857.8 cases per 100,000 population.
We learned that the pathogen Chlamydia trachomatis causes chlamydia, which is one of the most common STDs. Chlamydia targets the urinary and reproductive system in both men and women, with symptoms such as a burning sensation when urinating, abnormal discharge, and pain in the abdomen. Antibiotics are prescribed to cure chlamydia, but anyone can get the disease if they don't practice safe sex. Adolescents and young adults have the highest rate for chlamydia. Using condoms and getting tested is beneficial for prevention.